Hi, it's been a week since my prostate removal surgery, and tomorrow marks a major milestone. Tomorrow, they're going to remove my catheter. Now, the catheter is something that I worried about quite a bit leading up to the surgery, but I have to say that it really hasn't been as bad as I had really made it in my mind. So I do have a couple of maybe tips and things that I learned along the way that I wanted to share with other men who may be facing the same surgery and have some of the same concerns that I had. So first of all, it took me a couple of days before I would actually look at it. I tried to avoid it in the hospital as much as I can and really wasn't faced with what the catheter looked like until my first shower. And it really wasn't that bad. I mean, it's exactly what you expect it to be. The maintenance of the catheter is pretty easy. Now they sent me home with a catheter bag that could be strapped to your thigh. It's a much smaller bag, and it's intended for you to be able to go out and maybe go grocery shopping or take a walk around the neighborhood if you wanted that more concealed. I chose not to do that. One other thing that the nurse cautioned me about was actually changing out the bag multiple times could actually introduce possible infection just because you're exposing the tubes when you're disconnecting and reconnecting the bag. That wasn't the primary reason. The primary reason was I really didn't have a need for it. I didn't leave the house a whole lot. After my surgery, it was raining here in Texas almost every day, so I wasn't really doing any walking outside. But I did in the last few days, maybe the last 3 days, go outside several times and walk. And so what I chose to do instead of using the leg strap is just put it in a nice little bag. So my catheter bag, just because I don't want to show you what it looks like, is kind of in like a nice little gym bag. And just kind of hold that at my side and walk around the neighborhood and no one's the wiser. So that's very helpful. The other thing is you will feel it pull occasionally. So I recommend a lubricant on the tip of your penis, like Vaseline, just so that it's a little bit more comfortable for you, and also it doesn't dry out. When you shower, they tell you to make sure that you kind of pull just slightly, obviously, and just clean, make sure that there's no dirt or debris around where the catheter and the penis meet. So make sure that you're cleaning it and maintaining it. There's also, I don't know if I can show you, there's also a little clip. I'll step back. This, you can see it. The clip is helpful. I clip it to my shorts. You can clip it to your bed sheets, the nurse suggested, just so if you happen to move and it pulls, this is just a little bit more protection, keeps the tubing that is connected to your body close to you so that it's not pulling extra hard. Other than that, I am very excited to get this removed. I think life will be much easier. I'll be much more mobile after it's removed. On the other hand, I'm also very nervous because after they remove the catheter, this will be my first glimpse of what my continence will be after surgery. Expecting the first few days to maybe be a bit rough, but plan to do all of the exercises and hopefully gain full continence within the next couple months. So I'll continue to post more updates. If you have any questions, feel free to leave them in the comment section.